Do you have chest pain in the middle of the night, during sleep if you have pain, particularly if you are older, you are a smoker, you have a family history of heart disease, even if you are young, if you are having a sedentary life, you have to watch this video. Very important. In this video, I am going to talk to you about a peculiar situation we commonly come across. What is it? Chest pain in the middle of the night. People who sleep in the night suddenly wake up with severe chest pain, holding their chest, waking up. Sometimes they have vomiting sensation, heartburn, and then sweating, difficulty to breathe. This is a very common scenario which we can come across, particularly in people who are little elderly, 40, 50 people. So, what do we do in that situation? We should not panic, particularly when we are young, non-smoker, and there is no family history of heart diseases. And in situations wherein you have taken a heavy meal, more than the quantity that normally you take, or the quality of the food is going to be very complex, spicy, oily, outside food, or a grand dinner, particularly with or without alcohol. In those situations, probably culprit could be the food that you have taken, and the indigested food is coming up onto the food pipe. When you lie down, probably you would have gone to the bed much earlier than you go, and then it comes up to the esophagus, produces severe esophagitis, kind of choking sensation in the chest. This could be the cause for the pain. But normally, when suddenly somebody wakes up and says that it's a chest pain, the family members panic and then they suspect heart attack. That's natural, correct in a sense. So in that situation, when there is no outside food, there is no heavy dinner, and you are not a smoker, and definitely you can consider going to an hospital. Before that, probably you can relax, try to take some water, some antacid that you have at home, or you can have some buttermilk, or you can have some tablets if you have pantoprazole sort of thing. You can try and take it out and then wait for a few minutes or few hours. Then if symptoms are not getting better, if you have severe doubt, probably you can go to hospital, no doubt. The moment you go there, they will try to rule out a cardiac problem, heart attack. They will take a ECG and then take a blood test which will confirm whether it is a heart attack or not. The problem is the first ECG immediately taken and the first blood test may not reveal that it is a heart attack. It may show normal pattern. So you may have to wait for 6 hours. Probably may have to be an observer in the hospital itself for 6 hours, and then they will repeat the ECG and then take the blood test. If there is any changes in the ECG or the blood test TROP-T is positive, probably a cardiologist will be called in and the treatment will be initiated. Good. In case if nothing of that sort has happened, what should be done? Probably you will be seen by a gastroenterologist in the morning and then confirm that it is only food related reflux esophagitis, and it may be confirmed by an endoscopy and further evaluation and medications. But the thing is, the word of caution is, if you are elderly, more than 50 or 60, and if you are a smoker and you are living a sedentary life and you are obese and taking medicines already for kind of arthritis kind of drugs, you have to immediately go to a doctor and then see and rule out a heart attack. That's why as gastroenterologist, we recommend everyone to take early dinner, easily digestible food, less quantity, not full stomach, and then maintain a gap of at least 2 hours, ideally 3 hours from the dinner to the bed. If that is not going to happen, particularly when you take a heavy meal, outside dinner, full stomach, and then coming back home and then go to bed early and then sleeping in a supine position, all that will predispose this kind of situation. So in such situations, suppose you are forced to take a dinner late, heavy meal, you have to come home and then sleep in a semi-recumbent posture, either in the easy chair or a couch, for at least 2 to 3 hours, and make sure that the food has been partially digested and sent to the small intestine and stomach is almost partially empty. Then you can go to the bed and lie down. This is very important precaution everyone should take. And then when such pain occurs, even if the patients are not elderly or having any cardiac problem, even those young patients sometimes do have heart attacks. Those who don't smoke, who are obese, who don't have any exercise at all, these people also have heart attack in these days. So you have to be very careful. Chest pain should not be ignored. At the same time, if the immediate remedy at home is not going to help you, never ever hesitate. Don't panic, but never hesitate to go to hospital and seek the medical help. This is a sincere advice I would like to give you when you have chest pain in the middle of the night. Don't panic and face it boldly. Dear viewers, if you have any doubts or you need any clarifications in the content of this video, please feel free to put it in the comment box. We are going to discuss a lot of similar gastro-related problems in future. Please stay connected to our channel and see all those videos. Thank you.